because I think most of it, I think you already know, especially those of you who has been working in clinic kesihatan or in the primary care health settings. Okay, and I think you have to go back and read yourself on the very many apa tu, articles or manuscripts around about school health, as well as WHO articles on school health, because it is very a lot of things that you can find during your reading on what is actually about school health. Okay. Okay, so we start with what is school health services. Is actually I don't know why I cannot hilangkan benda ni in, hold on. Ni mana? Okay. School health is actually services. Okay, school health services is actually the services from medical, teaching, and other professionals applied in and out of school to improve the health and well-being of children, and also sometimes the families. It is an avenue, a very good avenue for early intervention, because there we meet the children, and as we know that children, the more early intervention we give to them, the better the outcome. So we as public health specialists can take that avenue, to convey our messages to school health children, to school children, in terms of public health teachings and messages. Okay. These services have been developed in different ways around the globe, so it's quite different and similar in other settings in other countries. But the fundamentals or the basics are constant. That is early detection, correction of any health disabilities, prevention of diseases, amelioration or mitigating of disease, disability, and abuse from which school-age children can suffer. Okay, this is the time because they go to school since in preschools, which usually sometimes even starts at 4, and they finishes at 17. So we can see that there's a long period of time that we see them as they grow and develop in an environment where they are reachable. Okay, so as for history, it started off in 1886 in France, followed by other European countries such as Belgium, Hungary, Chile, Germany, Great Britain, and in the United States. Okay, so what do we define as comprehensive school health? So comprehensive school health is an integrated set, so meaning it has a lot of strategies, which is planned, sequential activities and services, primarily to promote the optical, physical. Again, we're not only talking about physical, but we're also talking about emotional, social development of students in school. Okay, this program, which is also we have in our country, but in our own way, involves and is supportive of families and is determined by the local community based on community needs, resources, standards, and requirements. It is coordinated by a multidisciplinary team and accountable to the community for program quality and effectiveness. So if during this lecture you have anything to ask or to put in your experiences, because you are out there in the community, you can just raise your hand and you can give your opinion. Okay. So schools act as an ideal intervention setting, as I mentioned just now. It can reach almost all children during critical periods of development, because as we can see nowadays, almost all children go to school, and very minimal, unless in adverse effects, that children do not go to school. So they are reachable at this time. Comprehensive school health is a framework that incorporates individual, interpersonal, and community, as well as organizational factors, which direct and indirectly influences on health. So in comprehensive school health, it involves teaching and learning. It's a two-way communication. It involves social inputs as well as physical environments. And usually in a comprehensive school health, they have their own health school policy based on what are the needs of the school children in that school. And of course, we have partnership and services with other agencies. Okay, for example, what example we can say in school that we have with other agencies, maybe you can think and discuss. Okay, so why do we need school health program? So of course, to achieve the potential school children, because this is the time when they the earlier school children in their earlier ages is the time where they receive education more easily rather than giving them at a later age or when they're adults. And this is the time where they fully participate in educational activities. So education is not only based on academic curriculum, but can be incorporated into health promotion as well. So and of course, during these academic years, they must be healthy, attentive, with and emotionally secure, so they can receive adequate educational inputs, that is being given during the school days. So, what else is the significance of school health? School can make a significant contribution to increase the quality of life of children and students, at the same time for the staff and the wider community. Okay, and this is achieved by becoming health promoting schools. Becoming a health promoting school or comprehensive school health program provides a way for each pupil to listen to and take account of the views of pupils, parents and staff. Okay, in this school health program, we're not only look into the views of pupils, but during the parent teachers meeting, we can see the parents and they can give inputs in order to increase the health capacity of the school surroundings, and of course the staffs or the teachers can be involved as well. So everyone can be giving their inputs in terms of getting into a school health program or comprehensive school health program. Okay, a positive health promoting schools can also influence the health attainment, achievement, expectations that we want in a student or children. So other significance of school health programs is learning and health. Of course, as I mentioned, go hand in hand. Apart from learning the academic stuff, the health is as important as well. Good health of children and young people is a prerequisite for education achievement. Okay, if the children are not healthy, it is going to be very difficult for them to get the education that they need, or what is being given at school. So good health of teachers is also thus very important to develop the effective school health program. Okay. So at the same time, health promoting schools not only aim at empowering students, but it aims to empower staffs and parents and to actively influence their lives and their living conditions in terms of health. So other significance will be understanding the complex factors that lead to academic underachievement. During this school health program, we can understand some factors. These factors include academic underachievement, poor school attendance, students drop out, and poor health outcomes. Okay, and this because we don't want these complex factors to happen during the school days. Physical and emotional health problems is also very important. It ranks high among the factors contributing to chronic absenteeism. Missing 10% or more school days for any reason is a key risk factor for failing to complete school. So school health program not only looks into the health of the children, but they look into the emotional aspect as well, because these aspects might contribute to underachievement as well as students drop out and other poor school performances. And otherwise, health-related problems contribute to academic underachievement are also a primary responsibility of the medical home, the family, and the school health services team, led by the school nurse in the health office on a daily basis. So school nurse usually we don't have in our setting in Malaysia. This is usually in the Western countries such as in the United States or in the Britain or United Kingdom. So we don't have a dedicated school nurse in school. We have is that pasukan kesihatan sekolah, if I'm still right, okay, that goes to school. But it's actually good to have a school nurse in schools, right? Because any problem related to health can be directly referred to the school nurse who is attending to the school health needs. Okay. A growing body of research indicates that school nurses can improve attendance by reducing illness rates through education about preventive healthcare. You know, what are these school nurses apart from looking at the sick individuals or school students? They also can do preventive healthcare, such as recognizing early disease processes and improve chronic disease management. Okay. So if the studies to say that if a school nurse sees an illness or injury, 95% will be able to return to the classroom for further education. So if you have time, you can go to this this article or manuscript, Health as a Strategy to Improve Both Public Health and Education by J. Colby. And in this article, it's mentioned that health education and economic productivity are interdependent. Health children learn better, and reciprocally, more educated adults lead healthier, more productive, wealthier, and longer lives. So this says that health and education are hand in hand, as we have seen just now. Health and education agencies are increasingly recognizing the need to purposely address the interdependency of these separate efforts to improve respective health and education outcomes. So again, this is with respect to importance of health and education. School health programs enable health education and other relevant agencies to collaboratively integrate multiple school health components that can improve both health and education outcomes. It states that education must with relevant agencies to improve school health programs. Many school health interventions are effective in improving health education and economic outcomes. The last is collaborative partnerships, especially between health and education system agency, are required for schools to improve both health and education outcomes. So this is another recent manuscript by Lloyd in terms of how we improve health and how to advocate health, education, and partnership between different agencies. So the 8 components of a coordinated school health programs is what is written here. Okay, they can be about what are the programs that we can incorporate into school health programs, such as nutrition services, physical education. Of course, we have said just now, family and community involvement. Sometimes we do this in our setting. We have this persatuan ibu bapa dan guru-guru, so we involve not only educators like teachers, but we involve the family like parents as well to improve on the health outcomes in the school. Services, this is you can see how services, this is a portion that can be contributed by Ministry of Health, where they come with the pasukan kesihatan sekolah to schools. Okay, in our setting, counselling, psychologists, and social services. Yeah, in school we have counselling services. I think in Malaysia we have counselling bertauliah, to give counselling to problematic or anything that arises to improve the emotional well-being of the students. They can be referred to these experts, counsellors, and psychologists. I don't think they have psychologists, but counsellors are there in schools. Health education, yes, at times, sometimes there are personnel from the Ministry of Health, such as nurse or medical officers who come down to school and give health education. Promotion for staff, and of course, the schools should advocate healthy school environment. Okay. So, how does WHO define effective school health program? An effective school health program can be one of the most cost-effective investments. Okay, we must say that it is a very cost-effective investment a nation can make to simultaneously improve education and health. WHO promotes school health program as a strategic means to prevent important health risks among youth and to engage education sector in efforts to change the educational, socio-economic conditions that affect risks. So as WHO has mentioned, it is very cost effective. This is where we can as we've discussed, that we can put our effort to improve certain health conditions or public health initiatives within the school community. So this one, you can go back and read about what are the initiatives, what are the articles that WHO has given out to improve the school health programs in schools. Okay, for example, you can go back and look into WHO website, how they promote physical activity in schools, an important element of a health promoting school. How to prevent HIV, AIDS, and STDs and related discrimination, an important responsibility of health promoting schools. I think this is another important topic. Once upon a time, I think we have that ProStar punya apa tu? I can't remember what the ProStar stands for, but it prevents HIV and AIDS transmission among school children, and it's a very good program. It was quite a success at that time, and in Malaysia, but okay, I don't know what they have now in schools about HIV, AIDS, and STDs. Tobacco use prevention is an important entry point for development of health promoting schools. So this is another of WHO suggestions, because sometimes smoking starts at an early age during school time. So this is where we can come in and give public health talk or preventive measures so that the children do not go into tobacco smoking and things like that, because this smoke it may lead to other substance abuse in future, that can be related to tobacco use in earlier age. Okay? Violence prevention is another important element of health promoting school, where we teach children, about the danger of, being violence, because as we know that, whatever they do when they're young, sometimes it is it's stabilized and it manifests again when they're at a later age. So I think it's very important to introduce a violence prevention in school. Healthy nutrition is another initiative that is very important, because it is an essential element of a health promoting schools, and where we teach children to take healthy nutrition. Sometimes we have in our country, I think program makanan tambahan. I'm not sure whether we still have for underprivileged children. And of course dulu ada pemberian susu kan, minum susu. I'm not sure whether we still have that. Maybe in your programs you can discuss about that. Okay. Other important aspects is family life, reproductive health, and population education, key elements of a health promoting school. So reproductive health is another important element. Okay, as we know, they have sex education in school, but of course these have some drawbacks as well, because this is where we want to introduce to school children the importance of positive reproductive health. Sometimes far ahead we want to think about reducing teenage pregnancy and so on and so forth. So this is another important aspects or elements that WHO has initiated. Creating an environment for emotional and social well-being, an important responsibility of a health promoting and child-friendly school. So we have a nice, we would like to introduce a nice emotional and social well-being in and around the school. Physical school environment, an essential component of a health promoting school. This is also important. Sometimes I think in terms of reducing certain diseases, infectious diseases, for example, like sometimes the IKs go down to school to reduce diseases, for example, such as to make the surrounding the physical school environment more conducive and more healthy for the children, to prevent diseases such as dengue and so on. Okay. The last one I cannot read here. I don't know why. Okay, you can read, and you can find the articles on the website. Okay. So these are some examples of school health services around the globe. Okay, this is in United States. The school nurses support student success. The first one, they say that school nurse is an important element. It promotes, protect, and optimize. And they work with families and students to develop individuals' healthcare plans and provide health counseling to students and their families. So we've already mentioned just now, in the Western countries, they have school nurses to support school health services. Okay. In another one in Virginia, also in the United States, they have prevention services, education, emergency care, referral and management of acute and chronic health conditions to ensure identify and prevent health problems and injuries at school. And they provide first aid, administration, medication, provide wide range of health services. So this is another example in the Western country. So, okay, this is a school health nurse. What are their roles? This is again in other countries that they, what are their role in school? They manage medical management such as asthma and allergies, anticipate the development of action plans for the management of diseases, recognizes abuse and neglect. This is another important element, I think, because sometimes, you know, this is very difficult for us to recognize abuse and neglect in the community, unless sometimes a teacher or a school health nurse would recognize this. You know, I wonder whether you have seen the movie. I can't remember what movie is it, about a school, about a child. I can't remember where. If anybody remembers, in the United States, a story about a child who came to school. The teacher notices that he is being abused, you know, with his eyes swollen and there's a lot of bruises on him. You know, he's can't remember his name. Just watch the movie, and the teacher called the social worker. Social worker went to the house, but nothing was done. Really, nothing very emergency was done until at last the child was, you know, was parents and died, and died. Actually, very sad because the teacher actually the child is being abused, but no emergency action was taken until the child died. Participants in the health arena such as immunization, obesity prevention, abuse assessment. Okay, in overcoming problems of obesity, school health nurse with his or her daily presence in school, assess blood formation of students. They can implement these strategies like PI screening, you know, for collaboration with personnel to advise them on administer healthy food and promote opportunities for physical activity as well, educating parents as well. Okay. So as quickly you go to other countries, this is what they do. They have a chart in Japan. Okay, what they check. This is a checklist that they have. Okay. This is what they have. This is the chart. What they do. They have education in terms of health education, health management in that country. Okay. So in Singapore, we have primary 1, primary 2, and primary 5 and 6. What they do, the screening that they do there, in terms of vision screening, growth and development, I think it's about similar to our setting. Okay, spinal screening we also do when we go down as pasukan kesihatan sekolah. We also look at these factors. Okay, these are other school health programs. Have healthy, safe school environment, health as topic in school curriculum, emergency and urgent healthcare in school, physical education, education for special and disabled children, training, supervision of teaching staff, nutrition education, okay, lunch and breakfast programs, family life and sex education, and STI and HIV education. Okay, these are other programs that we have been discussing: violence and sexual assault prevention, safety orientation, awareness of hazards of substance abuse, personal hygiene and grooming, physical education, training in first aid, medical disease control, mental emotional health, understanding health of community, understanding health in the family, understanding promotion of, I cannot read like the last sentence. Okay, you can go through. Okay, in Malaysian experience, okay, I think you are more aware because I've not been working in the health promoting school for such a long time, and maybe there are newer techniques, newer prevention strategies that they have introduced. Okay, this is what as a generalized introduction to what is being experienced by the Malaysian Health Promoting Schools. Okay. School health services were implemented in 1967 as a collaboration between the Ministry of Health and Ministry of Education. Okay, there must be good advocacy between these two agencies. In 1995, WHO introduced health promoting school based on the Ottawa Charter. And the concept were adopted by Ministry of Health, and they started the school health program. Program they call it as Program Bersepadu Sekolah Sihat. Okay. In 1995, WHO introduced the concept Global School Initiative, and so our sekolah bersepadu sekolah sihat. It is based on the concept of WHO School Health Initiative. So it aims to improve the health of students, school personnel, families, and communities. Aim to increase the number of schools that can truly be called as health promoting schools. So first there was healthy schools, but then they have a facelift and coming out as school health promoting. Sorry, what was the name just now? Sekolah Program Bersepadu Sekolah Sihat in 1997. Okay. So this there was reorganization of the health programs in school. There focuses and emphasis of there was emphasis on health promotion and community participation. Okay, so this is what they have. Similar, it's actually similar with the global initiatives. So the school health services is our pasukan kesihatan bersekolah, but in terms of the schools, they need to have ability for self-care, children self-care, community participation. Healthy and safe social environment, healthy safe physical environment, and the school have to have a school health policy. For example, if there's a lot of students smoking, they can have berhenti merokok as their policy of if they want to have a good healthy body image, they can have active physical activity or so on and so forth. Okay. So some of the school health policy that they have, such as cigarette-free school, health and safe physical and social environment, safe building and clean area, community involvement, advocacy and direct involvement of other communities. Self-care ability means to give an increased awareness of knowledge in improving students' health status. So in terms of pasukan kesihatan sekolah of health teams, it is derived of two, the school health team and dental health team. Okay. I don't know whether medical and health officer do they still go down to schools. I'm not sure. Okay. Or medical assistants, they go down to school in health teams. Okay. So this was what they have, where pasukan kesihatan sekolah goes down to schools and give immunizations, give health talks, check for physical health of the children in terms of looking at the spine and looking at the hair for lice and things like that. Okay, and referring what is needed and what is supposed what illness they can refer to the hospitals or health clinics. So this is the coverage for primary and secondary schools. Okay, the school health teams is under the district health office. It's usually under the district health office, and who provide what to school children within the Ministry of Health. Okay, so in terms of family health development division or kesihatan keluarga as opposed to disease control division, two different divisions that give services to school. For example, in the school health unit, they look after the pasukan kesihatan sekolah, school health unit team, and also there's children with special needs, adolescent health and nutrition. Disease control is to reduce CBDVs and vector control. For example, CBDVs in terms of looking and managing prevention of tobacco use, prevention of obesity, prevention of smoking, and school inspection. Okay, health promotion, they have this mental health. Recently, I was called to give health talks in terms of Menda Sihat to school children. And of course, there will be health talks on substance abuse and injury violence. Okay. Health education, I think they have this Dr. Muda in school. I don't know whether it is still there now. I think there is. Okay. And so the school health program scope covers health promotion, primary prevention through vaccination, health screening, simple health screening, for example, taking the weight and taking the height, physical examination, and curative, whatever you can give simple treatment to children, dental health and mental health. Okay, and in terms of Ministry of Education, they give education in terms of family life education, and I think you can add on sexual health education in terms of that can be given by the Ministry of Education. So this is what currently, as I've said just now, they have immunization, risk assessment, and peer-to-peer activities such as Dr. Muda and dental program. Some have set, they have food supplementary programs such as food program and school meal program, and they have sometimes advocacy in terms of smoke-free school, anti-bullying school, and drug-free school. Others would be these are school schedule, okay, provided by Ministry of Health. The visits by Ministry of Health in terms of giving immunizations and in terms of physical examination. Okay, for standard 1, standard 6, and form 3. Okay, and in terms of Ministry of Education, there will be food supplement as well as school meal program. Okay, these are the data in school health records. They have immunizations, and I'm not sure whether there is still the blue book still around. I don't know whether it's still around or not anymore. Okay, so where they can, in these data, what can be seen is we manage to see and manage to monitor on growth and developmental status, as well as physical examination and school immunization. All right, and what are the new two school health programs? They have HPV vaccine, okay, and that was introduced in 2010, okay, and I think maybe you can tell more if there's new programs such as the thalassemia screening and things like that. Okay, you can also read on the Ministry of Health annual report in terms of school health. Okay. In 2012, this is what they have covered. A total of 1.73 million preschools, primary and secondary school children were screened and examined. And the coverage by nurses has also increased in Sarawak from 97 to 99 for standard 1, 99% for standard 6, and 99% for 2011. So this is a very good coverage, okay, as shown by the report. Okay, visual acuity defect is one of the commonest morbidities detected among school children for 2012. The visual acuity defect has further reduced, as mentioned by this report. Okay, so this is the nutritional status of standard 1 school children in 2012. Okay, in 2012, for standard 1, the obesity is 5%. For standard 6 is 9%. I think this has increased in the past years. Okay, so school health immunization is it targets 95%, and this target was achieved over the last 4 years, and the coverage for oral polio booster and MMR booster for standard 1 school children, an increasing trend since 2009. But this is a long time. I think there should be a new data since 2009. I think you can check on what is the coverage for MMR in the more recent years. Okay? So again, in 2012, these are the data that they found in terms of morbidities that they detect during their school health visit for preschool, standard 1, standard 6, and form 3. These are the morbidities that detect in terms of eye infection, ear infection, scabies, and so on. So conclusion for 2012, this is a long time conclusion, I think you have to go to the BPKK or Bahagian Pembangunan Kesihatan Keluarga to see the more recent Ministry of Health conclusion on school health services. And in this 2012, they have mentioned that they have achieved the target that they set for 2012, and they will continue to focus on strengthening and improving the quality of care to school children population in years to come. Okay. So again, this is a fact sheet for 2014 and how much they have achieved in terms of dental health. Okay, and this is BCG coverage and DPT, polio, MMR, hepatitis B in 2014. Okay, right. And what are the challenges actually in terms of handling of school health programs is actually the resources availability, as we know that sometimes there's not enough resources available in terms of human resources. You know, sometimes the nurses are so packed with you know, so many demands in the clinics and things like that. It's going down to school might not be so easy. Okay, right? And of course, financial is also there, and the need of having a good coordination in terms of going down to school between Ministry of Health and Ministry of Education. And of course, whether when you go down, you do have adequate referral and follow up to the problems that they literally see during the first visit, and whether there's follow up to these illnesses. Okay. And what are the prioritization in terms of what are actually the problems, because sometimes one problem might not be similar to one school might not be similar to another school, so prioritization is also very important. And of course, lack of health knowledge among teachers. There's study to say that you know, sometimes teachers need to give the sex health education, and sometimes they don't feel that they have or adequate knowledge or capability to give such health knowledge to children and school students. And of course, we need training in terms of training of health personnel as well as the teachers in terms of giving out the educational knowledge. So what are the areas to focus on? Of course, as we know that children are now more affected by mental health problems. I think it's very rampant in the community nowadays. You know, that even happening of suicide among school children. So mental health, well-being, and how do we promote emotional and social well-being among school children to be at the optimum level, so as to reduce the mental health problems among the school students. Okay. And of course, the problem of nutrition and obesity is also rampant, because we see that there's more and more children becoming obese, but at the same time, in certain areas, some students are still having stunting and not growing because of poor nutrition and so on. Okay. So these are some of the problems: consumption of fewer servings of fruits and vegetables daily, lack of vigorous and moderate physical activity, and at risk of being overweight. So not only should we as public health should think about teaching these things to the school student, but the school policy themselves, they should have you know, a better policy or better strategies in terms of promoting more physical activity among the school students. For example, providing activity spaces for the students to have their physical activities, as well as provide time not only to stay in classroom and read and learn, but they also have to have moderate amount of physical activity, okay, or moderate or good amount of physical activity daily, in terms of reducing the occurrence of obesity. So some challenges and some how to improvement should be introduced or planned by the national level, and of course by the district level also. The primary healthcare level themselves, as well as the school level themselves. So this not only you know, the policy not only being introduced by the national level or the more higher level, but the school level themselves, they should think about, you know, how to improve the school health surroundings in their own vicinity. Okay. So I don't know, I can't remember what this is. You can just look at YouTube whether it's still there. Okay. and just look and go into in Google Scholars or Medline or PubMed about what we can read about school health services and how do we advocate school health services, what are the strategies that we can improve and why it is important. So please go to the website and read about these articles, okay? Okay, all right. So I think that's all for today. So just don't rely on the lecture notes. Go back and read more about school health program. Okay. So is there any question or is there any inputs? I would really like to hear inputs from you all because you are the ones who are working in the clinic kesihatan. If there's any inputs that you can give or you want to raise your hand and say something. Are you still there?
Yes, Prof.
Yes, Prof.
Yes.
Yeah. Anybody has experience working in school health program or school health pasukan kesihatan sekolah, whatever you call them in the district? Anyone?
Hi, I'm Dr. Hanis.
Yes.
I just want to share.
Yeah.
I was in PKD Kemaman last time, but I'm not assigned for school health. But from my opinion, I see that there is in Terengganu, there is lack of support from NGOs actually in
Okay.
activities. Basically, health school activities is like key roles of Ministry of Health. Even Ministry of Education also didn't even look in deep into these services. They more depend more on MOH.
Okay. Yeah.
From my opinions, from my view.
Okay. Yeah. So I think that is why when you work down in the community or daerah, you must always remember that we need to advocate or we need to introduce advocacy or a collaboration with these agencies. Sometimes they don't know, so they don't think the importance. They're not only giving academic inputs to these children, but they also have to play with us hand in hand in terms of increasing the health towards the children because it's very important. Okay.
And some more, there's a lot of cultural and stigma barriers. Still a lot in Terengganu.
Okay. Yeah. What culture barriers do you think about?
Culture barriers is more towards parents. Still got a lot of vaccine rejections. Like
Yes.
that. Okay.
Yeah, that's why it's good if I can get the new data on vaccine. You know what I have is very old, like 2012, 2014 punya data. I think the vaccine rejection rate might have increased in the past few years because a lot of people rejecting vaccines, isn't it? So that's another problem. Yes. So and anything else? Anybody wants? We get one more last. If anybody wants to give an input.
Prof.
Yes. Yes.
Saya Tina Karen from Kuala Langat.
Okay.
I used to work in Tambunan Sabah from 2015 to 2017. And
Yes.
I was taking care of pasukan kesihatan sekolah. And in
Yes.
Sabah, the program ProStar, program remaja sihat tanpa HIV and AIDS is very active lah, Prof.
Okay. I thought gone already. Still got
Masih ada 2017 bila saya transfer out masih lagi ada lah dan it is very active and that program is memang sangat like very engaging, interactive because we are focusing on the Form 4 students. So they have a lot of burning questions and the engagement session really help to explain to them regarding teenage pregnancy risk factors and other stuff.
Yeah, okay, very good. Yeah, that's actually a very good your effort kan in terms of that's actually the thing that we want to introduce to youngsters because they still have so many questions and sometimes they don't open to their parents, so that in school sometimes they are more freely, they talk with their peers, And if you have that like pasukan yang turun to talk about the pros, it is very good. Yes, thank you for your input. Okay. So anything else? Ada siapa-siapa?
Assalamualaikum Prof. Sumaya ya.
Kau salah.
Okay, I'm just curious about tak pernah kerja dekat klinik kesihatan atau terlibat dengan punya health promotion.
Yes.
Regarding because as we know sexual abuse among children in Malaysia, the cases is quite high. Okay, so just like I'm curious about how far is our sex education in school. Because as I know, we don't really like I'm asking like my nephews and my nieces, so they don't really learn about that in details, and I mean in details mean as appropriate for them. And I know now a lot of NGO that they do the like seminar for children and also parent regarding this issue. Like for example, the sexual education, like the part that are private, which one that if someone touch or do anything, you have to report, because children, they didn't really know about such things. So I'm just curious, like if we as public health doctors, like if it, because I feel it is needed actually to be implemented in the school for proper sex education regarding this.
Yes, okay, thank you, Sumaya. I think it's very good input. It is very important to introduce about sexual education. In terms, as you said, a lot of NGOs has given more effort in reducing the sexual abuse among children. I think this actually topic is not widely discussed lah. I mean, in the public sector, as just now, as I mentioned just now, like sometimes teachers they don't have the, dia rasa macam tak they don't have dia rasa tak berkemampuan lah to give this topic. We have received inputs from teachers to say that it's quite a difficult topic to discuss in schools. And NGOs are more open to these topics. Okay, but I think I don't know. There need to be more discussions about how to give sexual education in school. Yes, they have this topic. Kalau in the Western countries, they, yes, they give sexual education in classrooms. But the thing is, before giving this sexual education, sometimes they know that some parents don't like their children to be in the sexual education classroom because, the culture is banyak kan. Culture is not like in the, for example, in the Great Britain or United Kingdom, they have sexual education in the classroom, but beforehand or before giving the education, they give consent form so that the children go back home and ask the parents whether they can be enrolled into this classroom. So if the parents give consent, the children can go into this classroom and the teachers can go deeply into this topic. So sebab children ni dah dapat consent daripada parents, and if parents do not give consent, the children will be included in this classroom. So the teachers have more, macam lebih berkeyakinan lah sebab they already have the consent from the parents to give such education. I think that's just some input from other countries lah. So how we want to do it in our culture, which is lagi a lot of different culture, religious background, I think that has to be discussed more, by Ministry of Health and Ministry of Education. I agree with Sumaya. There's a lot of NGOs out there talking about this, and some parents also prefer to attend, ask the children to attend, and they themselves attend these NGO sessions. Okay,
because I feel the need for us to implement it, because the sexual abuse, about 80% of them is by their own family.
Yeah, yeah, yeah.
So this is like, and the cases is still high, especially in area of Kelantan, Kedah, and Terengganu.
Yeah,
So
yeah, yeah.
I feel like the need maybe is better if the sexual education come from Ministry of Health, Ministry of our Minister of Health, rather than the teacher give it, because
Yeah.
so that the parent will be more, it will and less reluctant if the
Yeah.
doctor, if us as a in public health sector is the one who gives the talk. That's
Yeah,
my
yeah.
like,
Opinion.
yeah.
Yeah, I think that's a good opinion, but yeah, yeah, when you become public specialist, you may advocate and suggest this, this to be done, but at the same time, there's always this problem of reduced human resource and reduced financial capacities in terms of giving such. Kan kadang tak ada masa, we don't have time because we have more busy in the clinics and so on and so forth. So probably maybe in future you can think about it and how to go about, so that we have this don't have so much problem of this sexual, sexual early sexual teenage pregnancy and so on, and which results in baby dumping and sexual macam-macam lah. I think not only children need to be taught, the community themselves need to be given education as well.
Prof, I think we should start a read about comprehensive education's SCSE, if I'm not mistaken.
Yeah.
Comprehensive sexual education, a new frames of sexual education in already implemented in developed countries and proven effective.
Yeah, maybe, yeah, maybe you can share with your friend and upload somewhere in iFolio or in this Microsoft Teams so that we can have a look at it, okay, and you can ponder on how we can when you work as public health advocates next time, you can see how we can see how things to be done. Okay. Alright, if there's no more, I think we call it a day. Boleh tak? Sebab ni hari Jumaat. I think you need to go for your solat Jumaat. Okay?
Yeah, it's okay.
Alright. Okay, thank you. Thank you very much. Assalamualaikum.
Thank you, Prof.
Thank you, Prof.